Hi, my name is Tori and I am a doctor of physical therapy who specializes in pelvic dysfunction, which means I treat things that can go wrong around the pelvis, and this includes issues that can arise after C-sections and other surgeries that result in abdominal incisions and scars, like hernia repairs or wide excision surgery for treating endometriosis, or colostomy reversals, or even at times hysterectomies. All of this to say, I've had experience working with abdominal scars in the clinic in order to improve quality of life, and I am a big proponent of scar tissue mobilization, aka scar massage. And while the majority of my experience does come from working with abdominal scars specifically, I do believe that a scar located anywhere on the body could potentially benefit from scar massage, especially during the first 2 years of its healing. In today's video, I want to talk a little bit more about tissue healing and the potential benefits of scar massage before walking you through how to perform self-scar massage techniques in real time. Of course, if you are at all concerned about whether or not scar massage is safe and right for you and your body, please do check in with your surgeon or another healthcare provider that you trust. With all of that being said, let's talk more about scar tissue and tissue healing. There are 3 phases of tissue healing and subsequent scar formation that occur after a deep wound, like a surgical incision, is inflicted. The inflammatory phase, the proliferation phase, and the remodeling phase. The inflammatory phase only lasts during the first few days after injury and is characterized by inflammation and blood clotting. Your wound is red, hot to touch, and swollen during this phase. The proliferation phase can last from a few days to 2 weeks or so after injury and is characterized by new tissue formation. During this phase, new tissue, specifically a type of collagen, forms to close and heal the wound. Your wound will scab, it might feel raised and warm, and even have some drainage during this phase. Finally, the remodeling phase can last from 2 weeks to 2 years, we think, after injury, and is characterized by the formation of a mature scar. For this reason, the remodeling phase is also known as the maturation phase. And during this phase, your scab falls off, reveals scar tissue, and the type of collagen that we talked about in the proliferation phase is slowly replaced by a stronger, more stable type of collagen. What's interesting about scar tissue healing is that sometimes, because of the way that the collagen grows during the healing process, the scar tissue can't move as well as uninjured skin can, and you end up with restricted tissue mobility, otherwise known as adhesions. And these adhesions can affect the muscles that live underneath of them. For example, someone with an abdominal scar might not be able to recruit her abdominal muscles as well as she used to, and this could lead to back pain, pelvic dysfunction, or other issues. Also, sometimes the scars themselves or the skin around them can become numb, overly sensitive, or painful. For example, someone with an abdominal scar might not be able to wear the same tight pants that she used to because the fabric rubs and irritates the scar tissue. And that's where scar massage can be so incredibly beneficial. We think that scar tissue massage could break up adhesions, or said another way, increase a scar's flexibility and improve its range of motion. We also think scar tissue massage can help desensitize scar tissue and return normal sensations to the area. Finally, we think scar tissue massage might increase blood flow, which promotes healing, decrease excessive scar tissue buildup, and improve the overall appearance of the scar. Unfortunately, there's limited research in this area. However, I've compiled some compelling studies in the description below if you want to check them out and learn more. Since we think that the remodeling or maturation phase of scar tissue healing can last for up to 2 years, most healthcare providers agree that that scar massage can be beneficial for a scar that is up to 2 years old. I would propose that scar massage can be helpful for a scar that is older than 2 years old. However, I cannot provide any evidence outside of my clinical experience to back up that claim. Finally, while the scientific and healthcare community does agree that scar massage should not be performed during the inflammation or proliferation phase of tissue healing, there are different opinions surrounding when during the remodeling phase is the appropriate time to start scar massage. Some surgeons will say to start self-scar massage 2 weeks after surgery, and others will say to wait for 3 months post-op. Again, if you are at all concerned about whether or not scar massage is right for you and your body, please do check in with your surgeon or another healthcare provider that you trust. All right, now that we have walked through tissue healing and talked more about the potential benefits of scar massage, let's walk through some self-scar massage techniques in real time together. I'm going to share gentler, kinder techniques for younger scars first, and then more intense, direct techniques for older scars. Feeling some minor discomfort like itchiness, tenderness, or burning during self-scar massage is perfectly normal. And while some people do like to use lotion, I prefer not to because I find the lotion makes it more difficult to move the skin and the scar tissue. Let's begin with the gentler techniques. I usually use these gentler techniques when I'm working with someone whose scar is between 2 to 4 months old. If you want to skip to the more direct techniques, you can go to this timestamp. You will need to make sure that your hands are clean. Grab a washcloth or a hand towel, lay down with me, get comfortable, and we'll begin. Hopefully you are in a comfortable position, and you can see here that I've just drawn a line with a Sharpie to represent an abdominal scar. First, I'm going to walk you through 3 movements that are aimed at improving the scar's mobility, and then 1 exercise that is aimed at improving the scar's sensitivity. Ideally, you would be performing these once or twice in a day. Let's begin with the movements that aim to improve the scar's mobility. We are going to start by placing 2 to 3 fingers just a couple of inches above the scar. Then we are going to try and stretch the skin around the scar, and therefore indirectly stretch the scar. First, by moving our fingers up and down. We're going to make this up and down motion 5 to 10 times. So we're going to go up, down, up, down. 3 more times. Up, down, up, down. 1 more. Up, down. And you noticed I started at the farthest right side of my scar. That's because you want to try to move the skin all around the scar. So you saw me start kind of off towards the right. Now I'm going to move towards the center, and I'm going to do the same thing. And we're going to do that up and down again. Here we go. Up, down, up, down, up, down. 2 more. Up, down, up, down. And then we're going to go farthest left here. And again, up, down. 4 more. Up, down. And again, this is something that we're doing 5 reps of in the video, but you can do 5 to 10 repetitions at home all around the scar. Great. And then depending on the location of the scar, if you can also move below the scar. So we just did 3 places above the scar. You can repeat the same thing below the scar and kind of go down, up, down, up. Good. Down, up, down, up, down, up. Again towards the middle, down, up, down, up, down, up, and all the way to the left, down, up, down, up, down, up, down, up, one more, down, up. Great. So that was our first movement, just going up and down. Next, we're going to do the exact same thing, but instead of up and down, we're going to go side to side. So I'm going to start all the way to the right on top of the scar, and this time we're going to go right, left, side, 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 and I think this is 5. Might have been 6. Same thing in the center, side, 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 side. And finally, the same thing, but all the way to the left, side, 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 side. And again, I could repeat now my side to side motions around the bottom of the scar, depending on the location of the scar. All right, so we've gone up and down, we've gone side to side. The last motion that we're gonna make around the scar are circles. We're gonna go clockwise and counterclockwise, 2 to 3 fingers, just a couple inches above the scar. And here we go. Clockwise, counterclockwise, clockwise, counterclockwise, clockwise, counterclockwise, good. Clockwise 4, counterclockwise 4, clockwise, counterclockwise. And again, you would repeat that clockwise, counterclockwise pattern in the center, all the way to the left. And if you can reach the bottom skin around the scar, the same pattern on the bottom of the scar. Again, feeling mild discomfort with these gentler techniques, like mild burning, mild tenderness, mild itchiness, is totally normal. And as you practice and get more comfortable, you can start to play around with the intensity of the stretch. You can increase how much you're stretching, and you can also increase the depth at which you are pushing your skin, again, depending on your comfort level, as that comfort zone kind of expands. Okay, the next gentle exercise that we are going to walk through is aimed at desensitizing the scar and the surrounding skin. So this exercise is aimed at returning normal sensations to the area, and this is where our washcloth or hand towel comes in. The hand towel that I'm using is dry, but you could totally do this after you shower or have a bath and use a wet washcloth or a wet hand towel. And what we're going to be doing is placing the hand towel right above the scar and doing those same up and down, side to side circular motions, but this time we're gonna use the hand towel to create sensation. So let me show you what I mean. 1, 2, 3, 4, 5, all around the scar, below it if you can too. 1, 2, 3, 4, 5, 1, 2, 3, 4, 5, 1, 2, 3, 4, 5. We're following the same patterns that we used in the previous exercise. We just did up and down. Next is side to side, but with the washcloth, you can just go for the entire length of the scar. So that could be 1, 2, oops, didn't mean to go on the scar there. 3, 4,
5, go underneath if you can. 1, 2, 3, 4, 5, and then we're gonna do our circles too. And we can go the entire length of the scar, just like we did with the side to side. So you could do something like 1 and get all the clockwise in, and then all the counterclockwise. 2, just like that. 3, 4, 1 more 5, and then do the same pattern below the scar with your clockwise and counterclockwise circles as well. And the cool thing about the desensitization exercise is that it doesn't need to be as exact. The intention isn't mobilization, the intention is to restore normal sensation. So as long as you are doing these different up and down, side to side, clockwise and counterclockwise circles around the tissue, you're going to get the same benefit. On to the more direct techniques. I usually use these more direct, intense techniques when I'm working with someone whose scar is 5 months old or older. For these techniques, you only need your hands, and what's cool about the more direct techniques is that they aim to improve the scar's mobility and sensitivity at the same time. Ideally, you would be performing these techniques once or twice a day. I'm going to walk you through 2 of my favorite techniques. Ideally, you'd be doing these once or twice a day. I am going to end with 1 lazy technique for those days where you just need to do it real quick and get to the rest of your day. All right, so for these more direct techniques, you're gonna take 2 or 3 fingers and you're gonna place them directly on the scar. And you do wanna start either all the way to the right or all the way to the left of the scar itself. So we're gonna start all the way to the right, placing 2 or 3 fingers directly on the tissue. This time we're going to hold a stretch. So we're gonna place our fingers here. We're gonna start in that up and down motion. We're gonna stretch that scar up as far as we comfortably can and hold. 2, 3, 4, 5, and then we're gonna stretch it down. 2, 3, 4, 5, and relax. Now we're gonna go to the center and we're gonna do the same thing, up and down motion, all the way up. 2, 3, 4, 5, and down. 2, 3, 4, 5, and relax. And then all the way to the end of the scar tissue on the left, we're going all the way up as far as we comfortably can. 3, 4, 5, and down. 2, 3, 4, 5. Ideally, you would be performing this up and down 5-second stretch in each direction 5 to 10 times along the length of the scar. So we just did 1 full pass. You would repeat that 5 to 10 times. Then the next thing we're gonna do are side to side stretches. So instead of up and down, now we're gonna lay directly on that scar tissue, and we are gonna stretch that tissue as far as we can to the left comfortably and hold. 2, 3, 4, 5, and then as far as we can to the right comfortably and hold. 2, 3, 4, 5, and release. Now we're going to go to the center as far as we can to the left. 2, 3, 4, 5, as far as we can to the right. 2, 3, 4, 5, and release, and then all the way to the left. Here we go, stretching that left side all the way to the left. 4, 5, and then all the way to the right as far as you can comfortably. 3, 4, 5, and release. That counts as 1 pass of the side to side stretches. You would want to do 5 to 10 passes along the scar. Last thing we're going to do are, instead of clockwise and counterclockwise circles, we're just going to aim to do little diagonals. So you're going to place your 2 to 3 fingers, and this time instead of up down or side to side stretch, you're going to try to go in that diagonal plane. So you're going to stretch diagonal. 2, 3, 4, 5, and diagonal. 2, 3, 4, 5. Switch to the center. Here we go, diagonal. 2, 3, 4, 5, diagonal. 2, 3, 4, 5, and then final length of the scar, diagonal. 3, 4, 5, and down. 2, 3, 4, 5, and repeat that 5 to 10 passes along the scar. The reason that we are doing these up and down, side to side, diagonal, or more rotational exercises is because you want the different layers of your skin and connective tissue and muscle tissue to be able to glide and slide in all of those planes of motions. You want those tissues to be able to slide up and down. You want them to be able to slide side to side, and you want them to be able to move in more rotational or diagonal type of movements. So that's the intention behind this exercise. All right, the next exercise that you would ideally be doing once or twice a day is something called skin rolling. And you can skin roll with your thumb and your index finger, kind of like you're rolling a booger, or you can use your thumb, your index, and your middle finger to accomplish that same motion. So what you're going to do is gather the tissue around the scar. Now, my tissue isn't going to be as easy to pick up and move because I do not have a scar. So I'm going to sort of force the movement here with my other hand, but you want to pinch and roll back and forth, just like this. And maybe do that for 5 to 10 seconds. And then you want to move more towards the center of the scar and do the same thing. 5 to 10 seconds, with the aim being to move all the way across the entire length of the scar, doing this skin rolling technique. And just like the other techniques, you would ideally be moving 5 to 10 times through the entire length of the scar. Now, skin rolling can be difficult depending on the type of skin that you have. For instance, skin rolling on my skin here is difficult. It's hard to pick up and roll. If you find that you are also struggling with skin rolling, you can use my lazy technique. So my lazy technique is intended for people who have a hard time with skin rolling, or if you can skin roll and do your side to side, diagonal, up and down, direct exercises that we went through earlier, but you just don't have the time that day. This is just an easy, lazy thing for you to do that will still accomplish some of what we are hoping to accomplish with these exercises. And I call it playing piano on the scar. So you can use all of your fingers, or you can use just one hand, depending on the length, the size of the scar, and you can just play piano. So maybe you're gonna do some scales, just like this. Maybe you're gonna strike the keys like this. Maybe you're gonna play little couplets, but the intention is just to play piano across the length of the scar. And ideally you would be doing this for maybe 1.5 to 3 minutes on a lazy day. Just trying to get mobility and desensitization along that scar tissue and surrounding skin. On that note, thank you so much for watching. I hope that this video was helpful for you. If you have any questions or suggestions or really anything to share, go ahead and comment them down in the comment section below. I do try really hard to read and respond to all of my comments. Don't forget to check me out on Instagram, and finally, if you want to, please do consider subscribing to the channel for more content, not only about pelvic things like today's video, but also about life things. Thank you again so much for watching. I hope that you have a wonderful rest of your day, and I will see you in the next video. Bye.